thing to, very hard to teach mental health in a class, particularly as the way you've described it, if your teachers are not particularly bought into it and not trained to it. I guess it's another thing, it's maybe a lower bar, to at least tell young people what bad mental health looks like and what good mental health looks like and how to ask for help. Do you think that happens, or do you think that would be an easier way in to helping young people, not trying to transform all schools as places where they have hours and hours describing wonderful, perfect, resilient mental health that we'd all like, but maybe just even more simple things around, here is what stress looks like, here is what burnout looks like, here is what depression looks like, or maybe other things. Here is how you can go and seek help for yourself. Do you see that happening? Would you like to see that more? Is that one of the ways in which schools or the government could at least make it slightly easier for young people to navigate some of these difficulties?
I've been seeing so many of my friends are like being suicidal, like they're even making joke about, oh, I'm so depressed, I need to kill myself right now, I can handle this, those tests, but they are not really like, they don't really know they are in serious situation, like they are like, they don't take it as a like big problem, and if someone suggests them to just go to like get proper help, they don't really take it seriously, and this, I think, is a big problem, and they don't even know where they get help from. So schools and governments really need to like educate people to like where you can get help and what's the sign of being suicidal or something like that.
Yeah. Okay. Giving people the information for what to look out for, and
I think it's really hard to know the point where it's, oh, am I just like sad, or do I need to seek help? I think like I've struggled with it too, where it's like I don't really know what is the point where I am actually struggling, and especially with like something like burnout, it's really hard. It's just kind of hits you, I think. Like you don't really know that it's happening until you really reach that point where you can't do anything. So I think like kind of showing them like these are some questions you can ask yourself, like how are you feeling, like in a way that's not just pure feeling. It's just like what do I actually have to feel to like reach that point. And I think also that's why like letting people know about like what bad mental health looks like, and different extents to it is really important, because it's not just like a diagnostic thing. I think mental health is more like a gradual line of like fluid things in mental health. So I think showing the fluidity and just showing the different struggles you can have, I think are really important for them to seek help as well.
As I'm sure you saw in the US, often they talk about in schools the language of mental health first aid. So you put it in the same bracket as like, schools often teach people if you have an accident or you're choking or something else. So make it sound less scary, and they're not setting this high bar for we're going to teach you all about totally transforming your mental health, but at least we can recognise some of the basics when, as you say, when you're really struggling. Someone brought up social media, and I think that's obviously a hugely important one, and probably opens a huge box of questions we could talk about. But I'm interested about, I'm firstly interested in terms of how you think, what role social media plays in the mental health for good or ill in Korean society.
For good, nowadays Korean dramas show mental illness as nothing that is just bad or negative that shouldn't be done. For example, a Netflix series, it was called, I actually don't remember the title. However, it really shows the picture of what actual psychiatrists look like, how they can get the resources, how can they get the treatment. So in a positive aspect, I think those efforts are going on there. However, on the other hand, for Instagrams or X, some people who are struggling from mental health, they post some of negative posts that contain negative information about. So, for example, I found someone to suicide with me. They just post this kind of text in the social media. So I kind of consent that it may influence others in a bad way.
Do other people agree with that?
Recently,
Mm.
dramas like maybe she was talking about the daily dose of sunshine in Korea. 정신병동에도 아침이 와요. Help break down some of the stigma surrounding mental illness and treatment by portraying these topics in a more accurate and compassionate way. However, many news outlets and social media platforms still spread inaccurate or distorted information about mental health, which causes people to hesitate to seek treatment and often hurts those who are struggling.
What's an example of the kind of, you gave a really powerful and really hard example to hear about people who almost advocate for harm online. What are other examples of kind of misinformation and unhelpful information that you might see on social media platforms about mental health?
Like, I remember coming across a comment on a YouTube video that used a term like people say "자해충," and which roughly translates to self-harm bug, and a derogatory word that combines self-harm with insect to insult people who self-harm. So it
Right,
made me
okay.
really unexpectedly small and deeply upset.
Really, that's awful. That's really horrible. Okay. And again, there's now so much research to show that even when it's not the kind of really extreme things you're describing, even just extended social media usage for young people and adults, the impact that has on their self-esteem, their attention, their sleep, their concentration, all these things, even if you're not seeing content about social harm or self-harm or suicide, even then, watching hours and hours of 15-second videos is quite corrosive for your mental health. Is that a thing that is acknowledged in Korean society? Is that a thing that's talked about in Korean schools? Is that a thing that's not discussed whatsoever? Is there a role for the government to play in describing the ways that your smartphone can be harmful to you? What do you guys think about that?
I think it's a general, like a lot of people have the general idea that it's bad for you.
Yeah.
I don't think a lot of people want to be spending that much time in their phones.
Yeah.
But I think it's a very normalized concept. And I mean, it was like a kind of a mentioned topic in this conversation, but I think Korea is a very individualized country where it's just like in like for example public transit. It's a very well used kind of transportation where you have a lot of free time when moving. But you can see like even if you go on like the transits, for example, everyone's on their phones and all of them are scrolling. And every single one of them I think are watching the 15-second videos and just kind of spending their time. And I don't think a lot of people recognize the impact that it has on their daily life. I think though a lot of people know it and a lot of the parents know it as well. It's like they tell them to stop, but I think it's very difficult to do so. And I think the resources to help them stop and, for example, redirection into healthier habits is kind of absent in Korea, I'd say.
Do you think the government, in some countries, many countries and states, the government's banned phones in schools? Do you think they should do that here?
Yeah, somehow. Yeah.
Yeah.
I think especially in like younger. I think especially in the beginning, it's like you're giving phones at such a young age. Like I was giving my phone when I was like 7, and I think that's like a really young age to be given a phone. And I think these days a lot of kids go on social media and go on phones from like however young they are, from kindergarten. I've seen like kindergartners with like smartphones. So I think it is really important to restrict that when they're younger, but I don't know how like feasible it will be in like older high school populations. Yeah.
The schools that have introduced it have often found that it's incredibly unpopular to start with. Parents hate it, young people hate it, and then in time they come to see the benefits and appreciate, even if you're just taking the phone away for 6-7 hours a day and they're still on it in the evening, even then you're sending a bit of a signal and giving students a bit of space. And behaviour, often there are studies that will point to behaviour improves in schools where they don't have access to phones so much. Interesting. We haven't talked much about COVID and the lockdown. which obviously you know will happen to you guys at quite sort of formative age. What many countries around the world have pointed to seeing the data showing a real change for the worse in young people's mental health since COVID lockdown, and more people missing school, kind of struggling to kind of readapt to normality. Is that something you feel like you've seen either in Korean society overall or in your own lives and your own sort of education journey?
For me, after COVID, after the pandemic, it felt harder to form a relationship, especially forming a new relationship with others, with friends, with classmates. So yeah, because in COVID-19 we were meeting through screens, through cameras, through Zoom or any other online services. So it kind of decreased our ability to talk with others, to have a conversation. So in that extent, I think it gave us negative effects, especially on students who are in the age of forming their relationships and so on.
I think also kind of building on the idea, like our previous discussion on like cell phones. I think it was like quite a long period of time where students were just kind of given so much freedom throughout their days. Even when they're doing classes, they're free to go on different sites, different activities, and different you're able to access your phone like 24/7. I think it really does connect to their focus, and it's just like I personally experienced myself where it's like, oh, I just want to like look at my phone when I'm like on Zoom.
Yeah,
it's just
we've all done it. We've all done it. Yeah.
It's really easy to do that, but I think like students definitely going from such a young age where they were looking at screens from so young. I think a lot of them have harder time conversing in person. Just kind of staying on the pure focus in the moment kind of lessons as well. And I've heard of a lot of like younger teachers, like teachers of like younger students, struggling to keep their focus, struggling to keep them all in like a classroom. So I think it definitely did have a lot of impact. And I would also say that it did have like some positive aspects. For me personally, I mentioned that I went to like an online high school, and that decision definitely wouldn't have been possible if it wasn't for COVID. If like everyone wasn't doing online school, I don't think I would have done it either. And I think it definitely opened up a lot of flexibility for people who need online education or who want to step out of the traditional path and go in through different aspects. So I definitely think that there were a lot of positive impacts of it, especially in bringing mental health conversation to the general population as well, because I think it's the first time where a lot of us were feeling lonely, like we were in like a very crisis area where we're like all of us are isolated, all of us are going through such different changes, and it's a very turmoil time itself. So I think it was a good period of time where a lot of conversations regarding mental health has happened. And I think that also was a period of time where a lot of books, TV shows, and things like that, and YouTube videos came out discussing mental health in a way that's positive. So I think there were a lot of cultural positives in COVID and how it shaped the conversation of mental health, and kind of making that problem relevant to everyone, I think was also very important. But I think like behaviorally and a lot of different aspects, it was definitely, I would say more long-term, it had a lot of negative impacts as well.
What do you guys think about the legacy of COVID on all of the discussion we've been having today?
I mean, it has positive impacts as well, but the thing is like so many people were like so young age at the same time, and it was very crucial time for them to socialize with others in face to face, and I feel kind of sorry for they missed it, because it is like it's not about education, but also it's the opportunity to connect with real people in school, and so I think it can also affect their personalities and stuff. So
That's a really
I
good
think
point.
it's really debatable.
Yeah, agreed.
Yeah.
It's a big, please.
Sorry.
No, go ahead.
And especially for the elementary schoolers, they were forcibly exposed to screen and the online materials. So the books and the other resources for their educations were replaced by the screen, by the digital device. So in that matter, I think it would have also influenced their neurons and brain stops. So I do not have any evidence, but I suspect that there would be some decreases on their educational abilities and skills.
I mean, I think every single teacher I've spoken to in multiple countries would 100% agree with you that it's impacted. And you're right, it's difficult to assemble all the evidence because it's only been 5 years and that's not always long enough to run big longitudinal studies, but the plural of anecdote sometimes is data, and lots of teachers would point to young people's ability to form relationships and attention has been impacted by the pandemic. Interesting. Anyone else want to add to this?
I'm an introvert myself, so COVID was, more than good. It was good for me.
Yeah, it's nuanced.
I'll have to go outside. I'll have to go to classes. I'll have to hang around with my friends. But I do think that it had a more of negative impact on young people because, looking at your cell phone screen is the only thing you can do in online classes, and clearly at social media there are like way more content that is harmful to your mental health than those that are good for your mental health. So I'd say that COVID, the pandemic was bad for the teenagers.
So we've been looking backwards a bit towards COVID, looking sort of into the future. I know many young people have watched, or many people in the whole of Korean society, and I've certainly seen, have watched the Korea is Over video. Is that something you all have seen? Is that something that's kind of resonated?
Korea over video.
The video that talks about like birth rates and demographics. Is this ringing a bell? Yeah? I guess.
Like the news.
Yeah. I guess I'm just interested, kind of thinking about the future, about how I think we've talked a lot about challenges and we've talked about kind of opportunities. Where is your level of kind of optimism for some of these changes about the taboo around mental health and the stigma and the way in which parents maybe in the past wouldn't talk about it at all, and that's maybe slowly moving? Do you feel like you can kind of look towards the future with some kind of hope and optimism that things are changing? Do you think it'll be very challenging to see those changes happen? What do you think the future holds for some of the topics we've been talking about here today?
For my parents, after watching those videos, they told me that ever since I was born, I was always like this. So they had perceived the tragedy. They know that this is a problem, but they feel hopeless on their way to solve this problem and to make a new solution to make a better future for their children. So yeah, in those ways I didn't feel those optimisms and those positive stuffs.
Okay. What do others think?
I mean, I personally, I think it's a really difficult topic because, like, objectively, I think it's a pretty difficult situation where it's just not going in the best direction. You'd hope so. And I think it's just kind of a well-known fact now that Korea is one of the highest countries for where like youths die with suicide.
Yeah.
and a lot of people feel lonely, a lot of people are isolated.
Yeah.
And I think that it's just kind of like a well-known fact now, where I think that kind of saddens me more to the fact that now it's a well-known fact, but there hasn't been that many changes.
Yeah.
So I think that like we should always seek for change in ways we can, and so I hope there's hope in some ways, and I definitely see some positive changes happening. And culturally, for example, I think we've come so far in discussing mental health, and I've read books and like watched movies where it has touched millions of Koreans because it talks about their struggles, and I think a lot of people are getting more vulnerable and discussing their struggles. For example, I think there was like a huge trend in books called like essays where they talk about their journeys, and it's just kind of how they struggled, how they overcome it, and there's so many books. If you go to like different bookstores in Korea, like half the rankings are like, it's gonna be okay, like everything's good, like you're gonna get better. So I think there are a lot of people who are trying to spread nice messages and very comforting letters and messages that are very needed in this country. So I think that we're, like, a lot of people have empathy and a lot of people have the emotions to support other people. So I think that in that case, we do have some hope. But society-wise, I'm not really sure. Most of my friends don't want to have kids.
Yeah.
And most of my friends, like a lot of them are post-marriage, opposed to kind of forming or seeing the future. I have discussions with my friends where they're like, I can't really imagine myself over 30, or like when my career's done, like I think that might be the end. So I think like a lot of conversations like that happen. So I think if we do need like a shift of balance and values, we're really more towards living a life that's full and good rather than just being the most successful person you can. But I definitely do have some hope, and I think there are definitely great people out there. So I hope, yeah.
Do others want to come in on that kind of positive message that we've heard, or give a different view?
I think it will be better in the future because in older generation they weren't able to get educations about mental health.
Yeah.
And there wasn't environments like to encourage them about mental health. But there is some environments like Mental Health Korea and peer support systems.
Yeah.
And many youth are learning about mental health, and some of them go through into mental health challenges, and they personally can know that this is a really important problem and we should solve this together. So maybe in the future, if the young generation becomes adults, they might be more open in mental health.
I think that's a really good point, and that's a good point to end on, Harper, because I mean, thanks to this organisation and the work that you're doing, a conversation like this would have been very unusual 5 or 10 years ago, right? Like this is, and it would have been unusual in the UK as well, and in parts of the US. It would have been. This is, you think you guys are living an example of the great work Mental Health Korea does, and clearly you're passionate and kind of ambassadors for it, and that's a kind of an encouraging sign that some of these changes are coming, and every generation tries to unlearn the poor behaviours of their parents' generation and undo their mistakes, and I guess it only needs to get a little bit better at a time for it to be going in the right direction. So maybe that's a positive note on which to end. But I guess before we wrap up, I guess I have been posing a lot of questions to you, and I guess are there things you wish I'd asked you about? Do you think that are really important in this conversation about mental health and stigma and the school environment and pressure in Korean society? Are there things you think we should have been talking about today that I haven't asked you about, or things you disagree with that have been said? Like, I think put the challenge back to you guys of what is there anything we've been missing that's an important part of this conversation, or things you want to add to that don't necessarily fit in one of these questions?
I just wanted to say that I think that the reason that why our Korean society can't overcome the mental health issue is just focusing on the result, the OECD graphs and the figures. We should focus on the reason why it had happened, why people wanted to die, because people aren't actually wanting to die, they just want to end their pain, their mental illness. So just simply saying we're on the first place of our suicide rates, so we should solve this problem. I believe that it doesn't work like this way. So at a governmental level, we should focus on the reasons and how people feel in the first stage.
I totally agree with her because people who want to die search about like painless ways to die, but there are certain painless way to live because they don't want any pain living in this world. So, but usually people just think that if someone attempts suicide, they just call a person who attempted suicide, not saying that someone was struggling with some other problems and he did his best, but he couldn't get and so I think it is important to people to look at the reason rather than looking at the results.
Yes, no, that's a really important point. Yeah, thank you.
I think that Korea is a very, we focus a lot on kind of standardizing people, I would say. As kind of like talking about the results, I think we are a country that really want everyone to reach the average in every kind of way, like developmentally, like academically, physically. Like I think we seek for a very standard kind of beauty and life and happiness. And I kind of hope to see changes and interventions that come to support various lives and various ways to be happy, ways to be well. Like I think as much as we talk about like well-being, there's a standard kind of view and image that we have of well-being. Like people who go on, like I think recently there's like trends of people going on jogs, I heard. And I think it's a very, very meaningful hobby, but it's not the only way to be healthy.
Yeah.
Like there are other aspects, and I think a lot of it come from, oh, I don't have the time, I don't have the resources, I don't have the financials to do so and live this healthy life. So I kind of hope to see the future where like people can have various ways they're building happiness, like they can have different hobbies, and I think kind of supporting a full, like generally you're like living a fulfilling life. I really hope to see that in the future and the changes that we're making. So yeah, I just think that we should really stop kind of standardizing everyone. This is like the only way you should go, especially in terms of good mental health, because yeah, I think it's definitely like a trend for a lot of people, and it's just you can have so many different ways where you're happy and well. So I think that would be really important, and I really hope to see that change.
Thank you. What do you guys think? Sort of final thoughts?
I think the most important thing right now is to promote mental health awareness in governmental level, because like Koreans are facing political chaos right now, and politicians are often ignorant about like how people feels about their mental health. So I think policymakers should more focus on promoting such conversations like about mental health and make policies about like well-being and stuff.
Thank you.
I don't know, it's a tough question for me. I think it is important to make laws and the government or the teachers aware the fact that having mental health issues or problems are not a normal thing. But I think I have to think a bit more to answer the question. But we gotta shift the atmosphere, we gotta shift the biases, but I'm just hoping that things will get better as time passes by.
Thank you. I mean, you're right, it is a huge question, and I think I'm struck by something you said earlier about in many places, including in Korea, there's a box. And as you say, the box begins with, okay, the OECD comparisons of Korea to other countries shows that its teen suicide rate is really high. Okay, but that's a statistic, that's a box. A theme that's run through this whole conversation is the only way you can open up that box, whether it's young people to their parents and guardians, young people to their teachers, young people to politicians, young people to each other, is through conversations. And this has been a really very open, very honest, very powerful, very challenging in a good way conversation. So I can't thank you enough for kind of the time you spent talking me through this today. It sounds like you're doing amazing work with mental health Korea, and I feel positive coming, that you've got incredible advocates with this organisation, and I'm just so grateful for your time. So thank you so much.
Thank you.
Thank you. Before wrapping up,
Yeah.
I just wanted to ask you a question.
Please, yeah. That's only fair. I've been asking you questions for an hour and 45 minutes. Yeah.
I was just curious, what's like in the UK if you talk about mental health issues or any other, and how is society dealing with those, confronting with those issues?
Yeah, that's a really good question. So I give a few answers to that. It's something we really worry about in the UK, and I know that the outcomes in the box, the OECD chart would say that things are much better, but every teacher I've ever spoken to, every head teacher, pretty much every parent, particularly parents of teenagers, are really worried. They're worried for a few reasons. They're worried about coercive social media use. They're worried about how young people are navigating some of these big choices in their lives with not sometimes the most healthy conversations in society about gender and sexuality. There is less of a kind of social taboo about asking for help, but that doesn't mean it's easy. That doesn't mean young people don't struggle. The pandemic has, as we talked about, has had a huge legacy. One of the biggest ways in which it manifests itself is the number of young people who miss school. It's much easier to miss school now, and they are really struggling. So I don't think we have any good answers. I don't think it's the case that Korea has these issues in a really bad way, and in the UK we've sorted it. Our mental health for young people is poor and going in the wrong direction. It's also got worse since the pandemic. I think the government is looking to increase the amount of support that's available in schools. Is looking to provide more therapists and more support through the National Health Service, and it does require teachers and schools to talk about these things. It is part of the curriculum, but it's none of these things are easy. So I think some of the challenges are similar. I think the amount of pressure that young people face academically is probably quite a bit lower, and I think some of the taboos around silence is less prevalent, but a lot of the underlying challenges we've talked about today are there. So that's why I'm here in Korea, because we all need to learn from each other. So yeah, I think it is a big source of worry in the UK, and it's certainly not the case that we've got it all sorted and everything's fine.
Right, can I just
Please, yeah.
This is the last question. So
Ask away, guys. Yeah.
I heard that there is a Ministry of Loneliness in the UK. That's
a really good question. So there used to be a minister for loneliness. There isn't anymore, but there is there are a number of pieces of work around social isolation, around social cohesion, around promoting kind of public health strategy, a bit like you were describing, that combines thinking about physical health and mental health. And a big theme that the Education Minister has talked about in the UK, the Education Minister and the Health Minister work very closely together to talk about resilience, encourage young people to be more resilient, and grit is the phrase that they use, because as you all know, and we've talked about in this conversation, it's not as if you can remove stress and challenges for young people, and you don't want to. That's not what education is about. But helping young people to develop what are called non-cognitive skills will be an increasing part of the national curriculum in the future. That's a really good question. Anything else anyone wants to ask?
I'm actually really curious about the UK and how the counseling services are kind of involved. Is it in these the public schools, or kind of like private services? Like how are they?
So schools actually often don't have a dedicated counsellor.
Mm-hmm.
They might have someone who spends a small amount of time in a school, but actually, something I should have said in answer to your question earlier is there are long waiting lists to access a therapist. So actually, increasingly, the problem is not that young people don't want to seek therapy. I'm generalising, of course.
Mm-hmm.
The problem is more often that a young person says they want to seek therapy, and they are placed on a waiting list that can last 6 months, 9 months, a year. There are not enough people becoming counsellors and social workers. At the same time, mental health issues are growing and have got worse since the pandemic, so the wait times are huge. And what that means is teachers are often having to play this role of effectively counsellors without training. So they're often seeing things in their classroom that are effectively either behavioural issues or academic issues, but really they are an unrecognised and unsupported mental health issue. So in theory, I'm sure you guys talk about this, it's the kind of the pyramids where bottom of the pyramid is kind of universal support that every young person needs. There's kind of the middle of the pyramid, which is like small group therapy or one-to-one, and then there's the top of the pyramid, which is people getting help in a hospital or with a medical professional. That pyramid really, the middle two bits, really struggling, so it pushes down the support that needs to be provided in schools. So teachers a lot of English teachers would say they feel like they are effectively having to be a social worker, but without the training, without the support, without the time, and that just manifests itself. So it's different. It's not the case that, I'm generalising, a lot of teachers in school would say it's not my job in the way that you've described. I think they would. A lot of them would say it is my job. I have to look after these young people. They would say, give me the time and the tools to do it, and the clinical support so that people who need help can get it.
Oh, I see. So it's a lot of the general, like the pyramid, like you mentioned.
Yeah, pushing down the pyramid. Yeah.
So are there more like national efforts that are happening in the UK, you'd say?
So they are seeking to expand nationally more support and therapy, but that takes time because you can't, you hire someone to be a therapist, they've got to be trained for years. So you can't just turn on the tap and then a load of therapists enter into the system. Yeah, that's a challenge. Yeah, it is a challenge.
Sorry, I just have.
Please, yeah.
But it's just speaking on that is, I think the kind of incorporation of like telehealth, for example, like online counseling, that has just kind of been on the rise. But I realize that it's really different. Like the state of which, how popular it is in different countries are really different. So I'm just kind of wondering how it is like in the UK. Is it something that's utilized often?
So a lot of therapy takes place online, just as a means of just distributing more quickly. Interestingly, when I was in Texas, that's one of the most profound interventions they've had is particularly when you have more rural areas, people miles away from a hospital or miles away from a therapy centre. I think something that's interesting, and I don't have a kind of, this is like a massive question that we're not going to be able to sort here, but is inevitably lots of people, young people and adults, are turning to AI therapy because if someone says it's 9 months before you can see a therapist, or ChatGPT is right there, that's what people are going to do. Obviously, that is a massively complex question, and there's all sorts of reasons to be very skeptical about that. But equally, it is something that people are doing anyway, so I'm sure it's a question that the government will have to think about.
Yeah, for sure. Like ChatGPT, all my friends just kind of, like, apparently you can do prompt where answer like you're a counselor, and then they would answer the question as you would as a counselor. And honestly, I've had like my friends who are like, oh, it actually helped me a lot. But I don't.
Absolutely. So there's lots of stories of people saying it's helped them. There's also, as I'm sure you can imagine, where this goes, right? It's responding to what it sees out, what the model has learned from, and it doesn't always give the healthy advice, and it's no substitute for a trained professional. But what happens when services hit breaking points, and that you can't. I'm not giving a view one way or the other, but you can't necessarily take that question off the table and say AI is going to play no role in therapy in the future, because
it's just hard.
It's just hard, exactly.
Yeah, for sure. Sorry, one.
No, please,
I just I realize in the States, it's their policy and their practices in mental health really differ on each state,
Yeah.
and that just kind of depends on each state's government. And I think that's pretty different in Korea, I'd say. We have like the federal government that really overlies the whole country, but I was just wondering how it is in the UK. Is it?
The UK is more like one big US. So there's two answers to that. UK is more like one big US state in that the federal government sets. For example, there is a requirement. It's called relationships, health, and sex education. Every school has to teach it. That includes some element of kind of mental health and well-being.
Right.
But the system is used to giving schools a lot of autonomy to decide how, the idea is, a head teacher of a school, a principal, is better placed than sort of someone in central government. But the issue of mental health calls that into question, right? Because if you think there should be more support provided, you can't say it's up to individual schools to make that decision themselves. You need the federal government to push, the UK government to push for it. So the short answer is England, Scotland, Wales, and Northern Ireland do their own things, but England is more like a single US state. It traditionally has let schools decide what they do, and this is a question as to whether they need to kind of give a clearer bit of national guidance, because every school is crying out for this. Smartphone usage is another one. At the moment, it's up to an individual school to decide do they ban smartphones or not. But you could imagine in the future that they might say, okay, well, no, it'll be a single national ban because the evidence is so compelling. These are tough choices.
I see. Thank you so much.
No, my pleasure. Anyone else want to ask anything? No, great, okay, brilliant, thank you. I'm so grateful. Guys, is there anything you wanted to add before we wrap up, or? No? Great, okay, well, thank you.